Hey guys, welcome back to Let's Talk Birth. This is Amanda, your host, and I'm really excited about today's episode. Now, if you haven't listened to the last episode, episode 5, the Birth 101 episode, I would suggest you start there because this is what follows that. That episode broke down what labor actually looks like from early signs to active labor all the way through transition. That was all stage 1 of labor. And like I said, if you haven't listened to that episode yet, I'd recommend starting there because it sets the stage for what we're diving into today. And if you've already listened to that episode, awesome. Let's dive in. Hey, I'm Amanda, mom, doula, childbirth educator, and birth nerd. Welcome to Let's Talk Birth, the podcast where we get into real birth stories, talk through the awkward stuff, and cover the things nobody told you about. So grab your raspberry leaf tea, get comfy, and let's talk birth. Okay, so you've made it through the marathon of dilation. You're at 10 centimeters. Contractions are intense, you're fully dilated, and now it's time to push. But what does that actually feel like? How long does it take? And what happens after the baby comes out? Today we're going to be talking about just that. All about stage 2 and stage 3 of labor. Pushing, the ring of fire, the moment of birth, and what to expect when it's time to deliver the placenta. We're also going to be talking about different pushing positions, how to reduce tearing, what's different between home birth, hospital birth, and birth center birth, and something so many people have heard about but don't actually realize how important the first hour after birth really is. Okay, so before we get started, let's do a quick refresher on what the stages are. Stage 1, which we covered in the last episode, is all about dilation, from 0 to 10 centimeters. It's from early labor to active labor, all the way through transition. Stage 2 is the pushing stage, from 10 centimeters to the baby being born. And stage 3 is the delivery of the placenta. Okay, let's start with stage 2, which is pushing. At many home births or midwife-led care, you'll be encouraged to wait for the urge to push. That's called physiological pushing. You breathe with your body, follow its cues, and push when the feeling builds. In contrast, most hospitals often use directed pushing. Not everyone, but most of them do, especially with epidurals. What you'll hear is take a deep breath, hold it, and push for 10 seconds. But it's not always what your body needs. One other style of pushing, which isn't necessarily chosen, is the fetal ejection reflex. It's a strong primal urge that feels like you can't help but push. It's like your body takes over and starts pushing the baby out without you doing anything. Now, the style of pushing that you do, whether you choose to physiologically push or do directed pushing, or if your body takes over and does the fetal ejection reflex, all of that depends on how long you've been in labor and what position the baby's in. All of those can feel quite different. Okay, so this is going to get a little graphic in a gross kind of a way, but there's not really an easy way to describe this if you've never had a baby before. But bear with me. The fetal ejection reflex feels like, you know when you have to throw up? Yeah. And there's no stopping it? That's what that feels like. I experienced the fetal ejection reflex with my first, and that was 1,000,000% it. It happened, and you just had to ride the waves, per se. Now, when people talk about the urge to push, which when you do physiological pushing, it is pretty much solely paired with the urge to push, feels a lot more like dry heaving, but in your vagina. So you'll feel this kind of bear down feeling where it's almost jerky and you feel like you're dry heaving in the opposite direction. And you pair with your body, you partner with your body, and you bear down, and that is what that pushing feels like. The urge to push with physiological pushing, you push when it feels like your body needs to push. Now, directed pushing usually happens when you get to 10 centimeters, which I'll hit that in a minute, but you don't have to push immediately at 10 centimeters, but a lot of times you do when you have an epidural. They will do what's called directed pushing, where the provider will look at the monitor and see that you're having a contraction and will do exactly that. Count for you, say, hey, let's count down 10 seconds and push as hard as you can. And then they'll usually have you do 1 to 2 of those per contraction, maybe 3, depending on how long the contraction is, and then take a break in between. I've been with moms who felt the urge to push with an epidural, and I've been with moms who did not feel the urge to push with an epidural because they could not feel anything at all. And so those moms definitely requested, and for good reason, to have someone direct them to push. Now, something that I just mentioned about not needing to push when you hit 10 centimeters, a lot of times the provider, when giving you a cervical exam, will say, oh, you're complete, or you're 10 centimeters. That means that there's no cervix around the baby's head at all. They don't feel the cervix anymore. That's usually the sign that you're able to start pushing, but it doesn't mean you have to start pushing. Now, none of what I'm saying ever on this podcast really is medical advice. I'm not a medical professional. I am a birth professional, but I don't do the medical stuff. I'm just here to educate you on the body's natural processes. So if your provider has something different to say and you've done your research and you agree with them or whatever, if what I'm saying contradicts what your provider has talked with you about with your special case, don't listen to me, okay? However, with the natural process, the physiological process of birth, when you hit 10 centimeters, you don't always have to start pushing right away. When that happens, that's what's called laboring down. It's when you're fully dilated, but you don't feel the urge to push, so you just wait. A lot of times that won't necessarily happen when you have an epidural, because you might not feel the urge to push ever, because you might not feel anything. Like I said, I've worked with moms where that was the case. But if you don't have an epidural, waiting until you start to feel the urge to push, or even just waiting a few contractions, will drastically improve your pushing ability. When you labor down, it's letting the baby come down naturally before you start actively pushing. When you do that, it can shorten the time you're pushing, reduce fatigue, and lessen the risk of tearing. In my personal experience with my first, like I said, I had the fetal ejection reflex. I had no choice. I was pushing whether I wanted to or not. With my second, it was a total curveball, and I felt my contractions change, but I didn't feel like I needed to push immediately. But I did go from sitting on the ball to standing up and feeling almost like I was doing the pee-pee dance. Like I was just standing there, and that's actually when my water broke, and I was waiting for them to fill the tub, and I didn't feel like I had to push yet. I felt totally fine. If I felt like I needed to push, we would have changed things up, but I was okay waiting, and so I did. I waited until they filled the tub, and then when I got in the tub, I waited for the next contraction, and then I partnered with my body and pushed. That baby came out in 15 minutes with 0 tearing. That being said, I am a big fan of laboring down. Now, did I labor down with my third? No, I didn't. And I'll get to this when I tell her birth story on a later episode, but I requested a cervical check to see how dilated I was so I could make an educated decision on what kind of comfort measure I was going to try next, and was told I was 7 centimeters dilated, 90% effaced. We were almost there. After that, I had 1 or 2 contractions, and then immediately felt the urge to push and couldn't help it. It was a fetal ejection reflex again, and this time she came out in a flurry, and it was wild and crazy, and it was 10 minutes from the cervical check to babies here. That being said, every birth is different. Just because you had the fetal ejection reflex in one labor doesn't mean you'll have it in the next one. But I am very pro laboring down if you are down for it. Now, you heard that I've had a almost 1 hour long pushing. I've had 15 minutes and then a 10-minute pushing. And I didn't tear with the 10 or the 15, and I barely tore with the 50-minute one. But overall, I need you to know there is no prize for pushing fast. Slower, gentler, more intentional pushing usually leads to better outcomes. Okay, now that I've completely lost my train of thought, let's reel it back and talk about the Ring of Fire. Yes, it's a real thing. My sister and I talked about it in the last Q&A episode. It's the burning and stretching sensation as a baby's head is crowning. It's called the Ring of Fire. It usually lasts between 3 to 15 seconds, but it can feel very intense. Now, it sounds scary, and we talked about it more in depth in the last Q&A episode, but one of the things that helps relieve the pressure, relieve the intensity, is to pause. Let the head slowly stretch the tissue and give your perineum time to open without tearing. Now, if someone says push through the burn, they might mean well, but I've seen that advice cause some serious tears. What I would say is to just take a breath, breathe through it, let your body stretch, kind of like when you're trying to stretch a muscle or trying to learn how to do the splits as a kid. You know, that whole thing where you just stretch and then wait a second and then push a little harder into that stretch. That is what you're doing here. So you take a breath, you breathe through it, and you wait for the next contraction. And to answer the question, what does it feel like? It feels like a burning sensation. It feels like if you scratched your skin with sandpaper and then poured rubbing alcohol on it. That's kind of the feeling that it has. It's just the feeling of stretching something that's never been stretched like that before. And like I said, if you push too hard through it, which sometimes your body is going to take over and that's just what's going to happen, but if you can take a second and breathe through it and let your body stretch, that will help prevent tearing. Other things that can help prevent tearing, different pushing positions. Pushing on your back is one of the easiest ways to tear. When you're stuck on your back, in fact, lying flat in general is one of the least effective ways to push. Here are some better options, just from my experience as a doula and personal experience as a laboring woman. If you get on your hands and knees, it opens the pelvis and reduces pressure on the perineum. If you do a supported squat where you're squatting down and either leaning forward onto something or someone or leaning back onto someone, it's amazing for opening your pelvis and using gravity. Kneeling over a birth ball or bed is very intuitive, and again, it opens your pelvis and lets your baby descend. But Amanda, I'm getting an epidural. How can I do any of those? Are there any other positions I can do other than laying on my back? Yes, you can. Side laying. Side laying is a beautiful position. I've supported so many women with and without epidurals in this position while they're pushing their baby out. You lay on your side, you lift one leg up. Most of the time you'll have someone holding it because you're too tired to hold it yourself. That's a great way. Can you do the hands and knees? Probably not. Maybe. It depends on how much feeling you have, but most of the time your provider's probably going to tell you no can do. Kneeling over a birth ball or bed, I've seen that happen with an epidural and it is wonderful. Again, only if you can really have, it depends on your level of feeling. Another position with an epidural would be at the edge of the bed. They can drop the foot down and put the birth bar up. If you hold that bar, you can hoist yourself up into a squatted position, which really isn't as intensive as it sounds. And that's an incredible way to get a squat going on with an epidural. And I have seen that happen with an epidural too. That's actually the position I personally tried to use for birthing my third, but they didn't get the bar up in time and she just shot out. Now, in the last episode, you remember me talking about the knees and the ankles and just what kind of positions your legs should be in for the different stages of labor. Again, looking back with early labor, you want to have your knees apart and your feet together to open the top of your pelvis. With active labor, you want to move your legs in an asymmetrical way to navigate your baby's head through your pelvis and past your tailbone. And as strange as it sounds, when you're pushing, if you have your knees together and your feet out, that is one of the best ways to get the baby past the rest of your pelvis, and it opens up the bottom part of your pelvis and gets baby down. Now, a lot of these positions don't necessarily allow for that exact knee position to happen, but the closer your knees can get, as long as your knees are closer together than your feet are, that's what we're looking for. Other positions that you can push in, pretty much anything that you can think of in birth in general. Any position you can think of is a laboring position. Any position you can think of while you're pushing is a pushing position. As long as you can get into it safely, it's the position you can get into. For example, my sister has now pushed both of her babies out while standing, which is crazy to me because I'd so much rather sit or lay down, but everybody's different. Every birth is different, and whatever your body feels intuitively is right is going to be what's right for your body within reason. While we're talking about pushing, let's talk about how long pushing takes. Now, I've talked about my pushing experience before and how long it takes. Typically, for a first-time mom, the range is between 1 and 4 hours. Now, that is including completely unmedicated moms. That's including epidural births. It's the entire range. Now, does that mean that if you're having a completely unmedicated birth, you're going to push for 4 hours? No, but it also doesn't mean you won't. Much like how all of the different pieces of dilation, the baby's station, and the softness and effacement of the cervix all has to do with how far along you are in labor, there are many factors when it comes to pushing and how long that takes. Baby's position. Is baby sunny side up, where they're facing away from your spine, or are they facing your spine? Is their head asynclitic, which means that it's kind of tilted, so it's not just the top of their head coming out, but it's more the side of their head almost. What station was the baby in when you started pushing? Everyone's cervix is a different length. So maybe you're 10 centimeters dilated, but the baby is still at a 0 instead of a +1 or +2. Have you had a baby before? That also comes into it. How tight or loose is your pelvic floor? Do you know how to push correctly? I'll give you a hint on that part. It's exactly how you have a bowel movement, which is why when you have a bowel movement, if you have a bowel movement in labor, no one's going to talk about it other than encourage you keep pushing how you're pushing. Now, most of the time, first-time moms, because there's so many different factors, take a little bit longer. Like I said, my first was almost an hour. I've had moms who were, I think I've said this before, 35 minutes was my shortest mom that I've attended. There was one who didn't make it to the hospital. She had her baby on the side of the road, which was crazy and amazing, and I will definitely have her on the podcast to tell her birth story because it was incredible. And I've had a mom who pushed for 4.5 hours. So again, whether it takes a long time or it's super fast, both can be normal. Now, after you've started to push and then you feel the ring of fire and you're continuing to push, you'll start to crown, which is where the baby's head is visible outside of the vagina. Then one of two things will happen. First is that you will go from crowning to, in one push or so, the baby will be completely birthed all at once, which is what for me happened with my first and my third. The other thing that can happen is your baby's head will be birthed and the shoulders will still be on the inside, and you wait a contraction. You wait for the next contraction. You take a minute to breathe, and then on the next contraction, you'll bear down and one shoulder and then the next shoulder will come out very quickly, just boom, boom, and then the whole body will come out after very quickly. When the baby comes out, everything can feel still. You might cry, laugh, say nothing at all, depending on how the birth went, how the baby was doing, if there's any other reasons for concern. The baby might be checked briefly, but most of the time, the process is as soon as the baby is birthed, whoever is there to catch the baby will then bring the baby to your chest. In a setting like a birth center or at home, typically everyone is very quiet. And if anything, there's whispered conversation happening, but it's not very loud, it's not very aggressive, and all this is depending on if there's any reason to be concerned. That's a whole different thing, but on a physiological, normal, healthy birth, usually it's very calm and quiet, and the baby is passed to you straight away. In a hospital, most of the time, they are a little louder and will do a lot more talking. When it comes time to pushing in a hospital setting, when you're getting close, when the baby is starting to crown, there is going to be a rush of people that come in. Normally, that's pretty okay. It's just a team for the baby and a team for you. It's nothing to be hugely concerned of unless you were told otherwise. When the baby is born and given to you, that is when the golden hour starts. And we'll get to that in a minute. But after the baby is born, stage 3 begins. The delivery of the placenta. Typically at home or in a birth center, you'll be resting, bonding, and your midwife will watch for signs of the placenta being ready. In a hospital, it's more likely that you'd get Pitocin, which, yes, happens in birth, but also during stage 3 to help continue the contractions to get the placenta out and to stop any extra bleeding. Fundal pressure is the uterine massage that they'll give on your stomach. A lot of times you might not notice it happening because you're staring at your beautiful baby and just living in the moment. Sometimes you will feel it. It all depends on how your body is processing things. They also, in all 3 cases, hospital, home birth, or birth center, might ask for you to try to bear down and push a little bit to birth the placenta. And typically it's painless compared to birthing the baby, but it's still very important. Now, you might have what they call a sticky placenta, which I have experienced now with all 3 of mine. And the provider might need to do a little bit of traction to kind of tug very gently on the umbilical cord to help the placenta detach completely and be birthed. and you might not. If you do have a stickier placenta, you're more likely to bleed a little bit more. The longer it takes for you to birth the placenta, to actively be birthing it, the more likely you are to bleed more. But it could also just take a few minutes before your body's ready to begin the placenta birthing process. Like I've said before and will say a million times over, every birth is different. Now, here's the thing. When the placenta is birthed, once it's out, your uterus needs to continue to contract to stop bleeding. Your team will look at the placenta and examine it, make sure that it's whole, that there's not any pieces missing, any chunks that came off while you were in the midst of birthing it, because even a small retained piece could cause infection or bleeding. Now, when talking about the placenta, of course, we need to touch on cord clamping and placenta options. You might have heard about delayed cord clamping. Now it's becoming more and more common for hospitals to do delayed cord clamping, but it's not necessarily what I mean and what most childbirth educators mean when they're talking about that. When they do delayed cord clamping, they're delaying it. They're not doing it immediately, but they're not waiting a long time. It's usually waiting about 1 to 2 minutes and then they clamp. If you would like to wait as long as possible until the cord is done pulsating and is turned white, that is pretty much completely up to you. Now, again, all of these things are within reason. If there are medical complications or reasons that your provider might say, hey, we should actually clamp this now or cut this now, that is completely different. I actually have a client family who, when they wanted to wait for the cord to be completely done pulsating and completely white, they waited until it was done pulsating. It wasn't completely white yet, but her cord was so short that the provider heavily suggested they needed to cut it in order to continue the process, because she wasn't even able to have the baby on her chest. The baby was on her stomach because it was so short and the placenta was still inside of her. Now, the last couple things with the placenta is, first of all, what happens when you birth it? What happens to it? Can you keep it? Yes, you can. People do a lot of things with the placenta. They can encapsulate it for consumption. They can bury it. They can do placenta art, which is where you take a print of it. It sounds gross. It's not that gross. It's not like you're using the blood for the print. It's washed and all that. Anyway, just if you decide to do anything like that and would like to take it with you, make sure you talk to your provider ahead of time and let them know that that's what the plan is. The last thing about the placenta, and it's not even necessarily about the placenta directly, but I mentioned fundal massage. That's where the provider will do kind of a not so pleasant massage, pushing on your uterus from the outside, from your stomach. And that is to help cause it to contract. And when you think about it this way, those contractions help stop the bleeding. After the placenta is gone and they made sure that it's completely intact, it will stop the bleeding or slow it down at least. Very much like if you have a cut and you just put pressure on it, that's what those contractions do. Now, if you choose to breastfeed, when you do that, that will cause similar contractions, and it's the body's beautiful design of taking care of itself and stopping the bleeding if there's continued bleeding. I mean, obviously, you're going to be continuing to bleed for the next up to 6 weeks or so, but I'm talking the postpartum, like if there's any chance of a hemorrhage, that it'll help stop that. You might not feel it. I did not experience it at all with my first. I absolutely experienced it with my second. The contractions that happened while my baby was nursing was incredibly intense, and I did not enjoy it whatsoever. It does slow down and eventually stop. It just takes a couple days. When you're in a hospital setting, more likely than not, they'll continue to do that fundal massage throughout the rest of the time that you're there. They want to make sure that the uterus starts contracting and gets firm. If the uterus is not firm, that is a sign that there's other problems happening. But as long as they are able to tell that the uterus is contracting correctly and getting firm, you're good. In my experience in the hospital versus at home, my home birth midwives only kind of just felt my uterus to make sure that it was getting firm and taught me how to feel it myself. So then when they came by the next day, they were able to ask me like, hey, has this been feeling firm or has it been feeling looser? And I was able to tell them in a more informed way, rather than when I was at the hospital, I had a nurse coming in often to do a fundal massage throughout my entire stay. Now, we're talking about the rest of postpartum. Let's back it up a little bit and touch back on the golden hour. The golden hour is what we call the first hour after birth. And it's actually more than just baby snuggles and getting to bond with your baby by just looking at them and holding them, but it's incredibly powerful. For the baby, it helps regulate their temperature, their blood sugar, and their heart rate. If you're having a baby who is having wonky blood sugar readings, skin to skin. Skin to skin means you take your bra off, you take your shirt off, you are wearing nothing on your chest, and your baby is down to their diaper and they are on your body. And more likely than not, especially if you're having a midwife, either midwife in the hospital, birth center, or home birth, midwives are more likely to than OBGYNs or nurses, but they might also as well tell you just always be basically naked from the waist up and have that baby in its diaper on your chest all the time, just to get their blood sugar up or down to regulate their heart rate and regulate their temperature. Skin to skin is also incredibly powerful and helpful for you. It increases oxytocin, which helps your uterus clamp down and reduces bleeding, like we talked about before with the breastfeeding and all of that. And it also, speaking of breastfeeding, helps with your milk supply. The combination of your placenta releasing from the side of your uterus, along with the skin-to-skin bonding that happens, causes a hormonal reaction in your brain that tells your body, hey, baby's here, it's time to start producing milk. Now, we will talk about breastfeeding in a later on episode, but for now, just know that skin-to-skin, the golden hour, it doesn't mean just breastfeeding or just holding your baby. It means actually physiologically bonding to your baby. And incredibly enough, skin-to-skin bonding doesn't just happen with you and the baby, but it also happens with the dad and the baby. Yes, dads should do skin-to-skin too. It can reduce baby stress and also builds an early connection and helps the dad feel more confident as a father. And what's beautiful is in the case of a C-section where there isn't the ability to do immediate skin-to-skin between the baby and the mom, the dad can take that place and do skin-to-skin to help the baby while the mom is finishing up in the operating room. When you are doing skin-to-skin, when you're doing that golden hour, try to keep your baby on your chest, uninterrupted if possible. Keep the room warm and dim. Let your body and baby settle together. All of the emergent checks that they need to do immediately after the baby's born can be done on your chest. They do not have to weigh the baby immediately. They don't have to measure the baby immediately. There's a lot of things that don't have to happen immediately. But what should happen immediately is skin-to-skin bonding. Skin-to-skin is incredibly important throughout the first few days, especially of baby's life. But during the golden hour, try to keep the baby on your chest uninterrupted if possible. Keep the room warm and dim. Let your body and your baby settle together. This hour is sacred. Lean into it. All right. That covers all of Birth 101 from last episode where we talked about stage 1. And now this episode covering stage 2 and stage 3. Everything from pushing to delivering the placenta to the immediate postpartum, or also known as the golden hour. I hope these 2 episodes have been helpful for those of you who have not experienced birth yet and are curious what it looks like. And if this episode helped you feel more prepared for birth, would you do me a quick favor? Share it with a friend, leave a review, or hit that follow button so more families can feel empowered and ready. And if you're still feeling nervous about giving birth, especially the unknowns, I've got something just for you. It's a free guide I created called The 5 Steps to a Fear-Free Birth. It walks you through the exact mindset shifts and prep that help you go from nervous and unsure to confident and calm. Grab it for free at the link in the show notes. If you're pregnant and want to feel more in control, this is the best place to start. And as always, if this episode raised any questions that I didn't answer, please go to the show notes, scroll all the way down to the bottom, and submit your question for the next Q&A episode. All right, that's it for today. Thank you so much for joining me on this wild adventure of Birth 101 parts 1 and 2. And I'll see you next time on Let's Talk Birth.